Hi, my name is Stephanie. I'm a nurse here at Riverside, and today I'm going to go over your instructions on how to prepare for your colonoscopy. It is important for you to follow the instructions that are given for preparation to ensure a safe and effective procedure. The following items are what you're going to need. You're going to need to purchase a bottle of polyethylene glycol or the name brand Miralax, 14 doses. You're also going to need to purchase 2 bottles of Gatorade. No red, no purple, 28 ounces in size. If you are diabetic, you can use the Gatorade Zero or the G2 Gatorade. You'll need to use the 2 provided Dulcolax tablets. If you did not have them provided, you can purchase over the counter at your local pharmacy. 5 days before your procedure, you're going to hold all vitamins, iron, fiber supplements, and herbal products. Keep taking all heart and blood pressure medications. Do not stop those medications. You can continue taking your aspirin. There is no need to stop that medication. And if you need to take any pain or anti-inflammatory medications, you can take those as well. If you're diabetic, speak to your healthcare provider about your diabetes medication. You will definitely not take it the day of your procedure. You also may need adjustment to your dosages depending on what you take, so talk to your prescribing healthcare provider. If you take a blood thinner, you're going to need to speak to your prescribing healthcare provider ahead of time to find out how many days before your procedure you're going to need to stop taking that blood thinner. This is very important conversation that needs to be had. Up until this point, you've been able to eat a normal diet, but now 2 days before your procedure, I want you to start on what's called a low residue diet. Foods that are low residue break down very easily and do not leave a lot of stool behind in the colon. Examples would be things like chicken, fish, rice, eggs, mashed potatoes. Things I want you to stay away from are things like fruit and vegetables. They have a lot of fiber in them and they're very slow to break down. Also, red meat, nuts, seeds, all of those things leave a lot of residue behind in the colon. The day before your procedure, you're going to need to start on a clear liquid diet. And when I say clear, that means not cloudy. So you can still have dark things like coffee, you can have dark beef bouillon, dark sodas, just nothing that's going to cloud it up. So you cannot have any cream in any of these products or dairy because that clouds the product. So you can have coffee but no cream. No chunks of anything in any of these products, just clear, see-through. Do not consume any red or purple products. And the reason for this is because your colon becomes a straight pipe. Whatever color you drink is similar to what is going to come out. So if you drink red, it looks like blood. So that's why we want you to avoid any red or purple products during this preparation time. If you drink just straight coffee and tea, you might be hungry. So you may want to have a variety of things that can keep you satisfied. Sodium is good for that. So you may want to have some clear chicken broth or beef broth because sometimes your body is craving sodium. So it's very important for you to remain on this clear liquid diet because we need you to clean out the colon adequately. If you eat anything other than clear liquids, you will be at risk for your procedure being canceled. The provider needs to be able to have a good, clear visual field so that they can look for anything diagnostically they need to make sure that you are getting an adequate procedure. So make sure you stick to the clear liquids on this day and leading up to your procedure. In the morning, the day before your procedure, we're going to prep your Gatorade and Miralax bottles. Miralax is a colorless, tasteless, powdered solution. In order to make room for it to fit into the bottle, we're gonna need to pour off some of the Gatorade. So open your bottle, you'll pour off down to the first indentation line to make room. And then you can just set this aside. You can drink it at a later time. And Miralax is measured in capfuls. So we're gonna put 7 capfuls of Miralax in our first bottle of Gatorade. We're gonna mix both bottles at one time, but we're gonna start with this one. And then just pour it in. Might be a little messy. And you're gonna put 7 capfuls of Miralax in this first bottle. And then you're gonna do the same for the second bottle. Pour off down to the indention line, and you're gonna put 7 capfuls in this bottle. This bottle of Miralax, this 14-dose bottle, should be empty by the time you're done. 7 goes in here, 7 goes in here. After you've placed the Miralax into the Gatorade bottles, give them a good shake. Make sure everything in the bottom has dissolved. And then we're gonna place them in the refrigerator so they're chilled for when you start drinking them. Remember, on this day, do not eat any food, just remain on clear liquids. It is important for you to stay hydrated throughout this procedure. At 4 p.m., you're gonna take the 2 Dulcolax tablets with a full cup of water. Please note, this may not immediately cause a bowel movement. It's 6 p.m. the night before your procedure. It's time to start drinking your first Gatorade Miralax bottle. You're gonna grab your first bottle. You're gonna wanna shake it up a little bit. Make sure it's all dissolved. You can begin drinking this as fast or as slowly as you would like. If you begin to feel nauseated, you can just wait 30 minutes and then resume drinking. Once you begin drinking the liquid solution, plan on being near a restroom. Within 1 to 2 hours or sooner, you should begin to have bowel movements that will turn to liquid. Eventually, those liquid bowel movements will become more clear and see-through. The color of the stool will vary depending on what you're drinking. Your colon should become like a straight pipe. What color you drink is what color you may see coming out, mixed with some yellow bile. You have been provided an arrival time for your procedure. 5 hours prior to your arrival time, begin drinking the final bottle of Miralax Gatorade mixture. Please finish this within 2 hours, which is 3 hours prior to your arrival time. Even if your stools are clear, I want you to drink the second part of the solution. When I say clear stools, I'm talking about clarity. There should be no form to the stool. It should be straight liquid with no sediment. This second part serves a purpose, and so does the time given. It is to clear off any remaining bile and mucus that your body's making. 3 hours prior to your arrival time, it is important to stop taking anything by mouth. No fluids, no water, no candy, no gum, mints, cough drops. Nothing by mouth 3 hours prior. It is important for you to come to the facility at the arrival time that you have been provided. You will need to bring a responsible adult to the facility with you. You and your responsible adult should expect to remain at the facility for approximately 3 hours. Wear comfortable clothing and be sure to leave all of your jewelry and valuables at home. When you come for your procedure, do not wear any lotion or powders on your chest or arms. The day of the procedure, please take these medications with a sip of water. Heart and blood pressure medications, any pain or anxiety medications, thyroid or respiratory medications. If you have an inhaler, please bring this with you when you come for your procedure. The day of the procedure, do not take any diabetes medication. If you experience any unexpected health problems with your heart or vascular system, to include arteries or veins, please call our office right away. We may need to talk with your doctor before your procedure or schedule your procedure for a later date. You should avoid having elective endoscopy or colonoscopy procedures for 6 to 9 months after having a heart attack or stroke. Following your sedated procedure, you should not drive or be alone for 24 hours for your safety. Thank you for trusting us with your care. We want you to be comfortable with the preparation process. As you're preparing for your procedure, if you have questions, please feel free to reach out to us. If it's during normal business hours, you can call your gastroenterology practice, or if it's after hours, you can call Riverside Nurse at 757-875-7880.